Upstate Medical University in Syracuse, New York, invites you to Be the Informed Patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. It's been thought that people who undergo surgery for head and neck reconstructive surgeries are more likely to have complications if they're allowed to eat within the first 5 days after surgery. An international team of researchers looked into that assumption, and we'll hear what they discovered from my guest, Dr. Hani Aiash. He's the Assistant Dean for Interprofessional Research at Upstate's College of Health Professions, and he's the senior author of this paper. Welcome back to The Informed Patient, Dr. Aiash.
Thank you, Amber.
Do many surgeons believe patients need to hold off eating for a few days after extensive surgery of the head and neck region?
Yes, Amber. In the past, there was a belief that initiating oral feeding shortly after surgery or removing feeding tubes early following significant head and neck reconstruction led to increased complications. In recent years, the consensus among experts regarding the perioperative care of individuals undergoing head and neck cancer free tissue flap reconstruction, as outlined by the Society for Enhanced Recovery after surgery in 2017, suggests prompt reinitiation of oral feeding following the surgical procedures. However, and because of tradition, patient recovering from reconstructive oral surgery using a free flap is most of the occasions are kept at NPO for 6 to 12 days.
And NPO means nothing oral, nothing going through their mouth.
Yes.
So is the thinking that the tissue needs time to heal before it's exposed to food and drink?
They were thinking like this, but our study proved that no, you can use the early feeding and we have a very good outcome after this.
I want to hear more about those results, but let me make sure I understand it. Now, the surgeries we're talking about mostly are done to remove cancers.
Yes, pre-flap reconstruction is a surgical technique used in various medical specialties, primarily in reconstructive surgery, particularly for areas with significant tissue loss or defects. Indication for free flap reconstruction include trauma, removal of tumors, congenital defects, chronic wounds that don't heal properly, or cosmetic reconstruction, to mention some.
And the thinking or the fear of letting people eat soon after the surgery, were patients allowed to receive nutrition some other way than going through the mouth during this time?
Yeah. Yes, in the old thinking, they use parenteral or IV, or sometimes they use nasogastric tube. But to ensure that they receive adequate nutrition during this time, two main methods are commonly employed. Enteral feeding, which this method involves delivering nutrition directly into the gastrointestinal tract with nasogastric tube, as I told you, or a nasojejunal tube that can be inserted through the nose and down to the stomach or small intestine, respectively. And parenteral nutrition, this involves delivering the nutrients directly into the bloodstream by IV lines.
So, if a patient needed any of those modes of nutrition, they would be in the hospital during that time, correct?
Yes.
I see. Now, your study appears in the journal Maxillofacial Plastic Reconstructive Surgery. What made you decide to examine this issue?
We decided to study this topic as there is limited research about early feeding shortly after free flap surgery, especially after head and neck cancer. Our study aimed to compile the evidence on the association between early initiation of oral feeding and post-operative complications like fistula formation, seroma development, and flap failure, and the length of hospital stay in order to suggest implementation of an early oral feeding protocol after free flap reconstruction among head and neck cancer patients.
Now, you used a few terms I wanted to ask you to define. You said fistula formation. What is a fistula?
The fistula is an unplanned tunnel that forms between two parts of your body that shouldn't be connected. It can happen because of injury, infection, or other reasons. Flap failure occurs when the surgical flap, which is a piece of tissue moved from one area of the body to another area during surgery partially or completely separates from its attachment site. Can happen due to various reasons, such as poor blood supply, infection, tension on wounds. And hematoma is collection of blood, as you know, that accumulate in the tissue of the neck, while is collection of serious fluid, clear and yellowish fluid that accumulate in the tissue of the neck. It's a seroma. And wound infection happen when harmful germ, like bacteria, get into the cut or scab or surgical incision.
You're listening to Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with Dr. Hani Aiash, Assistant Dean for Interprofessional Research at Upstate's College of Health Professions, and the lead author for the research paper we're discussing. Now, your team includes researchers from Saudi Arabia, Peru, Egypt, and Charleston, South Carolina, Reading, Pennsylvania, New York City. You looked back at paperwork for more than 1,000 patients. Were all of the patients from those areas?
Our study is a meta-analysis. Meta-analysis is a type of research study that combines data from multiple independent studies on a particular topic to provide a more comprehensive and statistically robust analysis, what we call increasing the power. And we have found new studies about these topics from other countries, like our patients came from New Zealand, UK, US, and China. But we are an international team. We are working with many people to get these results and not related to the sample size from these countries.
And to get the terminology right, early feeding means during the first 5 days after surgery, and late feeding was 5 days or later.
You are right. We use the definition of early feeding using a cutoff point of 5 days, and as outlined in all the study included in our meta-analysis.
Well, let's talk about your findings. Did you find that it makes sense to withhold food from patients for up to 5 days after head and neck reconstructive surgery?
We have a lot of finding here. We find there is no statistical difference between the complication between early and late feeding. According to our results, our findings suggest surgeons should consider implementation of early oral feeding protocol after flap reconstructions in patients affected by head and neck cancers. Also, we discovered that there is association between shorter hospital stay. This can be due to several factors, such as faster recovery, as eating shortly after oral surgery helps maintain their nutritional status and energy level, which can aid in the body healing process, improve patient comfort and satisfaction, promoting psychological well-being, enhancing healing of oral tissue. In these cases, they benefit from adequate nutrition to support healing and regeneration. Proper nutrition can help also to reduce postoperative swelling and pain. And early nutrition after surgery is usually associated with decreased risk of complications.
So when we talk about oral feeding after having a major surgery of the head and neck region, do you start with liquid? Do you start with soft foods? I mean, there's got to be some guidelines, right?
Yes, we begin with liquid, then we begin gradually to give soft food, then hard food. But usually we begin with liquid and soft food.
So what would you like doctors and patients to take away from your study?
The patient, I will tell them that the main reason for doing research in medicine is to find new ways to improve people's health. This research helps doctors and healthcare professionals provide the best possible care to you, to the patients, leading to the better outcome and quality of care for everyone. However, when having complex situations such as surgery, the physician assessment of their patient's characteristic is vital for deciding the best outcome based on evidence-based medicine that can be tailored specifically for you. So the patient listen to the doctors, especially when he applied the evidence-based medicine, especially if we have research prove that early oral feeding will help you. For the doctors, I will tell them that at the best of our knowledge, our study is the first meta-analysis addressing the impact of early oral feeding on various post-operative complications. as well as the duration of hospital stay following free flap reconstruction in head and neck. And I believe it's excellent article to have a look at it, especially when we prove that there is no difference between complication between early and late oral feeding, but we have also shortened the hospital stay with early feeding, oral feeding.
So it sounds like, based on your study, keeping a patient in the hospital just to feed them soon after the surgery isn't the reason you need to do that. There may be other factors that the surgeons can concentrate on, but keeping them with adequate nutrition shouldn't be one of them.
Yes, usually the decision to stay in the hospital after surgery depends on how well the patient is. As you know, we are doing personalized treatment. You cannot paint all the people with the same brush. This is what we call personalized. We are different. And this is why most patients typically stay in hospital for 10 to 14 days after these surgeries. It really depends on each person's unique situation. Some studies have found that this time can be reduced to as little as 6 days.
Well, Dr. Aiash, I really appreciate you making time to share your research with us.
Thank you very much, Amber, for inviting me. Thank you for hosting me.
My guest has been Dr. Hani Aiash. He's the Assistant Dean for Interprofessional Research at Upstate's College of Health Professions. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe. Find our archive of previous episodes at upstate.edu/inform. If you enjoyed this episode, please tell a friend to listen too. And you can rate and review the Informed Patient podcast on Spotify, Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.